It's an unfortunate fact that teen suicide rates have jumped in recent years. It's an alarming trend that's leaving many healthcare professionals, teachers, and parents wondering how to reverse it. Carolee McGrath sat down with the director of graduate psychology at American International College to learn more.
Well, you know, teens are very vulnerable. Their brains are still developing, and they really want to belong to certain groups in their peer groups. You know, and we all do. We all want to belong. And when they're not feeling accepted and they're feeling outside of the realm of everyone else, you know, they start to think about their own self-esteem and if they're worthy and things like that. And, you know, it's so complex. There can be so many things involved. There could be underlying depression. There could be bullying. There could be just too much involvement in social media where there may be some negativity towards that person. There could be so many things.
Now, according to the CDC, and this I was like blown away by, that this teen suicide is the third leading cause of death among kids from, and I say kids, from 10 to 24, and I'll still link those early 20s as kids.
Right.
That's amazing to me as a mother.
And it's really profound between the 15 to 19-year-olds. That's where we see the highest levels of suicide. And then we have to look at also the attempts that luckily, you know, were not successful. Much higher for girls than boys, even though we see a much higher rate of suicide for boys. The other thing is that we've seen the number of girls double since 2007 that have committed suicide. We're looking at around 2 in 100,000 back in 2007, and now we're up to 5. So
and boys have also gone up as well?
At around 30%. Yes, we can all look at the CDC government website to look at these staggering numbers and how, you know, they are increasing, and we definitely need to talk about this and address this issue.
So what is the effect? I mean, some people will say, well, you know, social media has a role in this. I mean, does it?
Of course it does. We're all subjected to our environment. We all reflect upon ourselves by what the outside world is telling us. Even as adults, we do this. So absolutely for teenagers, again, their brains are still developing. Their self-esteem is still developing. So they don't have the resiliency or the resources that some of us adults have to deter some of those negative feelings.
So is it anxiety from social media? Because you put up a post and you hope people like it. And when one person likes it, then you start to think to yourself, oh, well, maybe nobody likes me. Or you put something up and people come after you. Like, is it anxiety that feeds the problem?
I would say that is a piece of it, but I also say that maybe some of our teens just aren't ready to deal with the complexities of that negative feedback and understanding that some people have different opinions than you have. And once they get involved and the negativity continues, you know, it's just something that they start to ingrain into their self-image.
And what about things that people watch? Like last year there was this big controversy with a Netflix series called 13 Reasons Why, and the promoters of it said this is really to start a conversation about suicide. But many school districts across the country started warning parents that this is too graphic, you don't want to get into this, and there was a report that showed that the Google search for how to commit suicide rose by a certain percentage. I believe it was 26%. Do, you know, films or things of this nature influence or affect kids?
Again, of course they do. They affect we as adults. So of course our children are vulnerable to these things. And the school systems are where they're seeing the effects. I spent 5 years in the school system with 6th to 7th graders. I ran a social skills group with 6th grade girls. I've seen how they were affected by the media. And they ingrain part of what they see into their own self-image. Again, it's a developing self-image, and they are very vulnerable to taking pieces of what is out there in the environment and building it as part of their own and thinking that maybe this is them. So they're exploring. Remember, as a teen, how we explored. We looked for building our identity and who we were and who accepted us. And our teens are doing that still today, and will always do that. So whatever they're subjected to is going to at least leave seeds of thoughts in their mind.
And how do you talk to your kids about this without putting a thought in their head? Because I, as a parent, you know, you want to talk about something very serious. You want to make sure that everybody is safe and feeling good about themselves. You also don't want to give them any ideas. Of course, I'm not the psychologist. How do you bring this up with your kids?
You know, it always starts with the conversation of just asking them what's happening in their lives and how they feel, and maybe if there's anything that's out there they want to talk about, and if there's anything they've seen that they're confused about. That's where it starts. allowing them to tell you what it is that may have left some feelings that they're unsure of within. And again, that attachment with your parent is so important. We have children out there who don't have that. We have children who've been traumatized. They're even more at risk for unsafe behaviors.
And you also have parents, though, who will say, and kids who come from, great families who've suddenly committed suicide. Now the whole community is left devastated, and parents will say, I didn't know.
Right.
So what are the signs that you really need to be looking out for?
The things to look for is, of course, the feelings of depression, the sadness, the overwhelming sadness, the feelings of unworthiness, the physical attributes to look for in the sense of that child's environment changing, is that they're starting to pack up things and say, I really want to give this to my friend. They're starting to say goodbye. And they're doing that in a very subtle way sometimes by saying, I really want you to know that you've been really good to me, and I don't want you to be mad at me, but I want to tell you how much you mean to me. Things like that. Things that may seem like normal teenage behavior, because we all know as teenagers our moods shift and we may be different one day from the other. But when it's to the point where it's overwhelming and seems odd, parents need to trust their intuition.
Is there a certain state of agitation that they go through that maybe they wouldn't otherwise choose suicide if they could get somebody to intervene?
Yeah, at that moment, they feel that there's no other escape except for suicide, the ultimate escape, and unfortunate, the permanent escape. And if they could just get through that moment and get the supports that they need to see through whatever the problem is, that they can overcome, and that there are resources out there for them, then we would see a different outcome.
And how long does that moment last? I mean, could it be a 20-minute window that there needs to be intervention?
Well, that's so hard to say. But, the thing is they've probably thought about it before, and it has built up to that point. But in that moment, they can't see another way out. That's the issue. And building an awareness around that moment for both children and their families and adults that serve these children in schools, et cetera, is an important part also to help them to recognize, to call crisis when it's necessary, to put in resources into place such as counseling if they feel that's necessary. But again, sometimes it's that impulsive moment that we need to teach maybe things like mindfulness to help adolescents to get through those moments.
So what's the way out of this? So we see that these numbers have increased greatly. How do we reverse this trend?
It's very complex, but it all starts again with awareness, but in a way that's healthy for these children. We have health class in our schools where they address the issues that children and adolescents are dealing with today. And we need to talk to them about healthy behaviors and healthy relationships. That's one thing we're not putting into the equation today, is what is a healthy relationship for a teenager? And how do they maneuver when there are negativities in their world around them? These are the things we need to teach them, as well as the awareness for parents, school staff, school adjustment counselors, teachers, to pick up on the cues that a child may need some help.
Okay, this is a very heavy and dark topic, but certainly one that we needed to talk about. So thank you so much for coming in today and sharing your perspective.
Thank you for having me.